Hi everybody, my name is Caitlin Bamler. I'm here to present The Walls Have Ears and Sensors Too. It is a presentation on the use of IoT smart technology in hospital rooms and its implications for healthcare. So for this presentation, I want you to imagine that you are a hospitalized patient in the year 2030. You have been taken to the most amazing hospital in your area. They are all over the news for their innovations in technology and in healthcare, but specifically for their use of smart hospital rooms. But before you get settled into your nice new hospital room, I want you to know a few things. This hospital room isn't any old room, it is a smart room. A smart room is different in this way, that it is connected to technology, sensors, automation, and digital systems. It's used to make patient care safer, more efficient, personalized, and comfortable. Think of it as a room that is using technology to communicate information to caregivers about your care. In order to do all of those amazing things, smart rooms often use this function called Internet of Things, or IoT. This term refers to physical devices that connect to the internet and communicate with each other. In healthcare, it allows them to do many different things, including collect patient information, monitor patients in real time. This is the most important one, is communicate data to healthcare professionals, send alerts when something needs attention, and automate certain tasks. So it sends all this information it collects and communicates it with these other technologies. The things portion of IoT includes a bunch of different things, such as smart beds, patient monitoring systems, IV pumps, wearable sensors, voice-activated controls, motion and fall detectors, and smart lighting and temperature controls. So it is all of these different devices that have a communication network through the internet, and they make up IoT in order to make smart rooms function. Okay, but how does this whole process actually work? So sensors on or around a patient collect information such as heart rate, oxygen levels, temperature, or movement even. And that information is then sent through the hospital's network to a monitoring system. The system can recognize when something changes or falls outside of an expected range. If there's a concerning change, this can even alert a healthcare provider such as a nurse or a doctor. So this means that nurses and other frontline staff don't have to only recognize on their face-to-face assessments or their Q4-hour, Q8-hour checks. They can be notified when something needs attention in the moment. So this can be especially useful with a critical patient, or maybe you have a patient who needs a lot of rest because the hospital setting is particularly anxiety-inducing for them, and so it's maybe impacting their sleep. So we can monitor a patient from the bedside without a lot of intrusion, and this goes for more than just vital signs, as we'll see on the next. The actual functions within a smart room are endless. You could do a presentation on each and every single one of these. There are functions for patient safety. We're preventing falls from happening by checking if they're getting out of their beds. Their vitals, obviously, heart rate, oxygen, respiratory rate. There's even studies showing how they can study pain levels in patients. It can check other things such as IV pumps, call light activity, medication administration, battery levels in the environment. You can check to see what the temperature is. And in some cases, a patient can control that from a voice recognized system. One of my favorite ones that I did a little research on was the use of digital door signs. And in the case of a code blue, the door sign will turn blue and keep track of how long the code blue has been running. So just a couple of different things that are included in the smart room. And again, there are so many. I could go on and on about each and every piece. These technologies come a lot of different benefits for patients, including faster responses when help is needed, continuous monitoring without consistent interruptions. Um, like I said earlier, that's especially beneficial for pediatric patients or patients who are already anxious about being in a healthcare setting. It can improve safety through fall and movement detection. If you have a dementia patient, it can tell when they're up and wandering around with risk of, maybe leaving their room. It provides greater comfort through automated room controls. Like I mentioned earlier, some places might even have a tablet or voice recognized systems that allow the patient to control lighting and temperature within their rooms. And it can provide really personalized care that's based on the patient and what the patient needs. On the other side of this are benefits for the healthcare workers, for us. With this, we have real-time patient information. So you are getting updates as they happen. You can get automatic alerts when something falls out of range. It'll keep an eye on that for us. It will help us reduce repetitive monitoring tasks. Again, there is studies that for sleep deprived patients, that is a major impact to their health. And if we can reduce some of that interruption, this is a major tool that can make our lives easier and their lives easier at the same time. It helps us prioritize patients who need immediate attention. So if we have constant information on different vital signs, we can see who really needs attention, might need a rapid call, things like that. It helps us improve communication between healthcare teams. We have access to information as maybe a nurse, and then physicians also have that access, which is an amazing tool, and it can help bridge that gap of communication. And then it helps us reduce the chance of misinformation. So with continuous monitoring, we're leaving less gaps in care. So with all of those benefits do come substantial risks and definite challenges. So with smart rooms, there are a lot of different components that are collecting sensitive patient information, very private information. So cameras, microphones, wearable sensors, medical devices all create privacy concerns. Patient data could be hacked, and so cybersecurity is a big factor to consider when it comes to these smart rooms. Additionally, privacy leads to patients maybe feeling comfortable and like they're being monitored. So part of why I wanted you to imagine yourself in the shoes of a patient is because privacy is a very personal thing. Next is high costs. So installing smart bed sensors, automated lighting, medical equipment, all of those things come at a high price tag. So you also have to pay for installation, software, maintenance, cybersecurity teams, IT staff training. Every single one of the things has to be considered when implementing these systems. And on the other side of that comes technology failures. So if a sensor stops working and the network goes down, you are losing such a vital part of your care team and system. So if it falls, you are going to have a reliable backup. You have to make sure your nurses are trained in what to do when that system goes down, as well as your IT teams. Another thing to consider is alert fatigue. I already feel like that's a major issue in healthcare systems today, as might you, being in a healthcare setting. So alert fatigue is something that we have to consider and that we're not overwhelming our staff. Integration problems can be an issue with all these different technologies. You have to make sure that they're compatible and can communicate properly through IoT. And so that's something that we have to look at. Staff training, like I had mentioned, we want to make sure that these caregivers can troubleshoot effectively. Obviously, it's not their responsibility to be technology prodigies, but we do have to have them trained on what to do when it's incorrectly used, if there are missed alerts, and how to deal with the type of workload changes that they'll experience. A con that we might see with smart rooms is reduced human interaction. So if a patient is in some of these smart rooms and a nurse or other caregiver is using them as a tool to avoid patients, they may feel as though their experience is an isolated one. So the technology really should be used to support human care rather than replace it. And then accessibility and usability, some of the things are with technology, it's important that we consider accessibility for everyone. So if we're implementing controls, room controls for lighting and for sound or for temperature, that those are accessible to people who have disabilities. Ethically, as healthcare providers, it's our responsibility to protect sensitive healthcare data. We must limit unnecessary monitoring, and it really should be focused around what are we doing to improve the healthcare of this patient and nothing more. So patients should understand how that data is being used, how it's being collected, and they should have a choice about a decreased use of technology in their care if they have that preference. It should be used to assist healthcare professionals. It is not replacing human judgment. So smart room technology should be reliable, tested, have backup procedures, and our healthcare providers should be comfortable in using it. So training, again, is important. In future smart rooms, we might see AI predicting and analyzing patient data and using this to identify early signs of complications or deterioration before they happen. In the future, you might also see rooms that automatically adjust lighting and temperature or bed position based on individual patient preferences and needs. These smart rooms might connect with medical devices, electronic health records, nurse call systems in one area. So we might see them all in one consolidated system is a potential that we might see in the future, as well as increased automation of tasks. So you might see nursing tasks become more streamlined, which could be a benefit as it may increase patient care, like one-on-one time with a patient, but it could also increase the number of patients that a nurse is designated. So I could see it going both ways. As far as recommendations, it's important that, again, we have a strong cybersecurity. If we are collecting so much patient data, it's our responsibility to protect it. We have to train our healthcare staff, maintain backup systems, ensure accessibility for all. And again, I will reiterate it again, this is not a replacement for healthcare providers. It is a tool that is used to assess them and to improve patient care. It is there to improve safety, to improve their experience. So with all that being said, how do you like the place? As a patient, would you in a smart hospital room feel safer knowing that technology is keeping an eye on you? Or do you feel uncomfortable knowing that you're constantly being monitored? So do the benefits of a smart room outweigh the risks and concerns? And most importantly, would you feel safe being watched if you knew the technology was there to protect you in the long run? So I believe that there's no correct conclusion to draw. But regardless, I do believe that widespread implementation of technology is imminent. We are already seeing smart hospital rooms in the US being utilized for healthcare. So it's our responsibility as nurses and healthcare leaders to ensure that's being ethically used and effectively used. So finding the balance between the human components and the electronic components. Here, America.